I'm crafting something very specific. Let's see if I can get it. Actually, slide down so we don't hear the paper. Keep going, more, till you're totally off the paper. More. Okay. Here we go. Got it. Made one single pop. Did you hear it?
Mm-hmm.
And that's a bigger one.
Mm-hmm.
There, that one popped. And whenever you're ready, I'll follow you. There it goes. All right, so we have Cupid here today. Thanks for coming in. And Cupid was connected to my Animal Cracker channel. So I don't know if you guys have seen, but I have a YouTube channel called Animal Cracker. I started it January 1st of 2021, so it's only 9 months old. I've done about 100 videos where I don't work on humans, I work on animals. Horses, dogs, pigs, chickens, cows, goats, sheep, and also cats. And Venus is Cupid's cat. Venus is a Maine Coon cat. And what's interesting about that video is it's my #1 viewed video on that channel. It has just under 1 million views, so it should go to 1 million views by the end of this week. And that's really exciting. This is a really cool cat. It's a big, beautiful, hairy cat. And it was getting its adjustment for the first time. You get to see the cat kind of processing it all. I invited Cupid in because he has post-concussion syndrome. When did you get your concussion?
2018.
Okay. Was it a car accident or a fall, or how did you do it?
I fell face first down the stairs throwing treats to my Maine Coon.
But no, it's just an interaction with your cat, right?
Yes.
You're just feeding treats and then you slipped.
Yes, I just missed the step and fell.
And how many stairs do you think you went down before you hit?
Around 25.
Wow.
And I landed face first in the middle of the staircase. So my forehead, my shoulder, my ribs, and my abdomen area.
Wow.
And I went to the emergency room, and they said I had a concussion, and said it wasn't going to be a big deal. But for the past few years, I've had auditory issues with processing things, energy level kinds of stuff, and then a little bit of a change in my personality. So
okay,
I'm hoping the adjustment today will kind of resettle those things that got knocked loose.
Okay. And he said like energy level, that's definitely one of the top 3 or 4 were fatigue. It's, people have crushing fatigue, irritability, mood swings, sometimes depression, anxiety from post-concussion syndrome. We hear a lot about post-concussion syndrome these days from athletes, people that play United States, and I'm saying that because a lot of people watch this channel from all over, but NFL football as opposed to soccer, which is what football is called in the rest of the world. But soccer or football for, with the soccer ball, a lot of concussions too, because, it would be great if you could head the ball in the perfect spot every time, but these guys jump up and fight for position, guys and women, and slam their head into the ball, and the ball's moving 40, 50 miles an hour, and that sport gets a lot of concussions. So we see a lot of the data coming from the sports, but everyday people have car accidents or falls or hitting their head. My mother hit her head on a New York City sidewalk. They thought she might even die from it, but it turned out she was okay. And during the pandemic, my dad, they're divorced and have new marriages, but he fell down the stairs and broke his neck last year. And it turned out he wasn't paralyzed. He was in a neck brace and a halo for a couple of months. But staircases are really bad. I mean, both my parents had bad falls in the past 12 months. And you're a young person compared to my parents that are in their 80s, but you hit hard and you're still feeling the effects of it.
Yes.
So one of the things we're going to try to do today is a cranial facial release, which has gotten results with post-concussion syndrome. I'm new with this technique. I've now probably done about 80 treatments. I've only put up maybe 10 or 12 videos of it. or 15 videos, but I do it all through the week in my office, so I've been doing it for a while. And my teacher, Dr. Adam Del Torto, had a 25-year career. He just retired this year of doing cranial facial release, and a big part of his practice out in LA, or Burbank is where his office was, he worked with a lot of cage fighters and mixed martial arts fighters and boxers and stuff that would come in that were bashed in the head through sparring and fighting and had different type of trauma to the head. And he had a lot of success with concussion syndromes. So it'd be interesting to see. And you know, that's why I was just wanting to say there's so many different ways that people can get concussions, and left without any attention, you just suffer. So we'll take a look at that. I would like to just check your neck and your back first. And Dr. Adam Del Torto always said, you know, make sure, don't forget to check below the neck and also do above the neck. So we're going to do first, we'll do head down, and then we'll do cranial facial. Right. So I'm going to have you lie on your back first. The actual cranial facial part doesn't take long. And I just want to see what your neck feels like. And do you feel this tight spot right here? Mm-hmm. So right now I'm on C2, and what's interesting about C2 is there's the occiput or the base of the skull, then there's the first bone, which is called C1. It also has a unique name called the atlas. The second bone has a unique name called the axis, A-X-I-S. And axis because there's actually a little tooth-like protuberance called the odontoid process. And dontoid means dental. So it's like this little pivot, and the top bone spins on it. And we get most of our neck rotation from those top two bones. Most of our upper skull nodding is between occiput and C1, but the actual rotation is coming from the top two bones, and especially the second bone, the axis, because it literally has a little axis or a process that the top bone spins on. And when that bone is misaligned, it'll hurt to turn your head. So if someone says, yeah, I can't really turn to the right so well, right away I'm thinking, I got to check the axis and the atlas, the top two bones. But the axis first sometimes, and that's where he has a muscle knot. So I'm going to see if I can adjust that now. Actually, do this for me. Turn your head all the way to me, as much as you can. Keep going, keep going, keep going. Any tightness that way?
Yes.
Okay.
In, like to the ear and the...
Okay, and now turn all the way this way with your head. Keep going, keep going, keep going, keep going. Which side is tighter, do you think?
This side.
Yeah, and that's what I found. So I found his rotational component of the axis, C2 on the right, with a rotational misalignment, so I'm going to adjust that. I know that's a little technical, but a lot of times people think I just line up and crack everything, and there is technical under it. I don't walk around talking technique all the time, but that's running as a in the background info in my head, and then I just think I got to crack that spot. But I'm cracking something very specific. Let's see if I can get it. Actually, slide down so we don't hear the paper. Keep going, more, 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 till you're totally off the paper. More. Okay. Here we go. Got it. Made one single pop. Did you hear it? Mm-hmm. When you watch back the video, you'll definitely be able to hear it. It wasn't a chain. It was like a pop, like a snap. Now I'm going to come to the other side to get a little bit more of the same area. And that's a bigger one. Mm-hmm. Now try moving your head all the way to the side.
Oh yeah, that's much easier.
And then all the way.
Yep.
So by specifically getting the motor unit that controls head rotation, he'll see an immediate change. Now I'm going to reach under, and I'm going to go into the upper thoracic area. And it already went on setup, just as I was rolling you into it. Did you hear it pop?
I did.
Yeah. That one's fine. And lie on your side facing me. So we're just going to do a few things and then go right into the cranial. But this will at least keep him open and fresh. That one's fine. Come to the other side. So that side did not pop. Now, so here's the argument too. So like, if it doesn't make a noise, was there an adjustment? And the answer is very often there was an adjustment, because you can have a noise and not have a successful correction. Let's say I crack someone's neck, but I make noise, crack, 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 and I leave the bone in a direction it did not want to go. So is that successful? In my mind, no. It made like a celebration of a loud crack, but the person or the patient didn't have improvement from it. So that doesn't get me excited. If I adjust something with the right vector, the right correction, the right force, at the right time and place, on the right location, it does not make a pop, but the person's functionality changes, where they're like, wow, I can touch my toes now. Oh, that feels good when I lift my leg. Then that's successful, even though it didn't make a nice loud pop. So I look more for that, but when we make videos, we want to hear pops because everybody's coming to hear pops. Or a lot of people do. There, that one popped. And that was L4, L5, but you know, the proof of the pudding, we'll see how he feels later today or tomorrow when he kind of tests everything out. And he looks pretty lined up. So now we're going to go into the cranial facial release. I'm going to have you back up towards me, and I'm going to start setting you up. The first thing I'm going to do is put this little neck roll under you, just to hold your head in place and hopefully be more comfortable. Here's a few tissues, because sometimes your eyes will tear, sometimes you'll you'll feel like you have to blow your nose right away. I don't know if you know about this, but this is our support animal named Floppy. Floppy was my daughter's little fun friend growing up, but my daughter's 25 years old now, and she donated Floppy. Do you want to hold Floppy or not necessary?
You know, I'll have Floppy here, and let me clear the bat cave for...
All right, and here's a garbage can if you want. What's good about Floppy, though, technically, is if someone holds on to Floppy, they're not reaching up for the balloon while I'm trying to get the balloon out. And reflexively, some people do that. They'll reach up and try to grab my hand while I'm finishing the last little bit. So it's good to have someone's hands on something to squeeze.
Is there something softer or a different position?
Yeah, we don't even need this.
Okay.
Yeah, that's a good angle for you. So try breathing through the nose, one side at a time, and tell me if there's one that feels more restricted.
This side's more restricted.
Okay, so let's start on the left. Here we go. You ready?
Uh-huh.
It went right in. You're going to feel a little filling. And when you're ready, you're going to open your mouth and then close it big and tighten your lips. One more. Perfect. It took 2 balloons. Do you want to sit up or just be there for a minute?
I mean, just hang out for a second. Let me take that in for a minute.
All right, no problem. That's what I meant. Some people need to sit. So it took me 2 squeezes. The first one, it started filling, but he definitely had fixation of bones. So bones, there's 22 bones in the face and cranium, and they make 64 different connections or articulations or joints. And right away I felt resistance of lack of motion. And then I let the bulb fill up again, and one last one crashed it through the back. And I kind of felt separation. Did you hear any cracks or anything?
You know, it's very clear now, and actually my voice sounds different.
Your voice sounds like more resonated, like a radio voice.
Yeah, like I'm getting more air in my nose, and it surprised me the second one when it filled up and I could feel the balloon go all the way through. But I think I'll be ready for the next crack here in 60 seconds or so.
No, it's okay. There's no rush. This is a good time to explain what the balloon does in the face. One of the things that the balloon does is it mobilizes the cranial bones. It releases direct pressure on the brain by having your bones squeezed so tight in your face. It relieves the dural meningeal tension, and the dura is like the sac or sheath on top of our brain and spinal cord. So it releases some of the pressure around that. And think of the casing on a hot dog being too tight. And we sometimes feel that way where, like our brain and our skull is just too tight. It definitely opens breathing passageways. It will facilitate sinus drainage, and some of the people that would come for something like this have breathing problems, migraine headaches, sinusitis, tinnitus, which is the sound in your ears, like the whooshing or ringing, vertigo, Bell's palsy, trigeminal neuralgia, sleep apnea, snoring, head trauma, and it helps a whole bunch of different things for people. But we don't really target curing any disease or ailment. All right, so we're going to do the other side now. Are you ready?
Yes.
Okay. Here we go. Almost there. A little more. No, it didn't go back enough. That side's blocked, so I've got to reset it. Now, I do know the length of the canal, the other one went all the way through.
Yeah.
So
Let me
this,
try to blow it a little bit, maybe.
so I decided to reset because if I start inflating the balloon with half of it out, it's going to bubble out immediately. Sometimes it will bubble out anyway because it hits the back and hits as far as it can go and ricochets out. But it's better to start with the most optimal setup I can start with, rather than start with something that's already half effective, knowingly that it's half effective, and try to just wing it. So let's try again. There's also 3 canals on each side, or passageways, and I just did the middle on the left, and I was shooting for the upper on the right. But if the middle is open on the right, it's a good place to start also, middle or upper. So I might go back in this time with the middle, and we might be able to get that right through. So let's see what happens. Ready?
Mm-hmm.
Almost there, a little more. Okay, got it. So I did do the middle. And whenever you're ready, I'll follow you. There it goes. So you can stick on me for a bit. He's going to take a second. So that one was intense. And that one took about 3 or 4. There's no doubt in my mind that he had a really bad concussion. I mean, obviously from the trauma that he described, a lot of times concussions, for especially post-concussion syndrome, is determined by history. So we know that the person had X-ray. We know that the person, in some cases, might have even needed an MRI back at that time period. But you also can clearly see from the type of history of falling down that many stairs and slamming his face into chest and face into the stairs at the same time, is a really big trauma to the skull, to the face, to the brain, bashing up against the structure. And so in a minute, he's blowing his nose. In a minute, we'll go back and see how he's doing and see what his comments are. Okay, we're back. So let's ask Cupid how he's doing. I mean, you got a nosebleed. Talk about that.
I got some blood, and I was really blocked on this side, and it surprised me how much pressure the balloon had to go in there and work. But I'm breathing much better on this side. And I was a little surprised about the blood, but it's not bad. It stopped bleeding, a minute after. And see how it goes.
Did you hear any crackling noises or separation, or what type of sensation was it for you on either side, or whatever you remember?
This is more of a crackling sensation, like it.
On the right side.
Yeah, like I could feel things. It was compressed and opening up, and still kind of settling into place now.
All right.
Yeah.
You're gonna probably blow your nose a lot today, maybe for a few days even. You might feel a little puffy. When I had this done, I got a little puffy in here, like it literally felt puffy.
Yeah.
I even felt pressure around my gums and teeth. I also tasted latex for almost like a day, like because the balloon is made out of latex, and I feel it like hit the back of my throat. Mm-hmm. I did a lot of these in one weekend, and I can almost taste latex all the time for a day or two. So there's like a lot of stuff you'll be feeling. You also still might get more bloody nose. Like later today, you might really blow your nose and go, whoa, there's more.
Okay.
It probably won't leak like a faucet later in the day, but you'll still get more and more, discharging and cleansing and purging. So do you think that's a good thing or a bad thing? I think it's a good thing. Someone else might be freaked out. One of the reasons why I want people to know the good and the bad of this, or the good and the shocking part of this, is I don't really want anybody to come in the office and go, I had no idea, that your nose could bleed, or I had no idea that the balloon hits the back of your throat, or I had no idea that the balloon can even come towards your mouth on some people, which you could see in Diego's film. If you ever go back, he's the one with Bell's palsy and the balloon comes up his mouth. And I thought about it for a while. Maybe I should cut that out. And I thought, no, let's run it the way it is, because then people come in and go, I watched your videos. I know what to expect, although you could never know what to expect, but they know what to expect a little bit. And they're like, but I want to do it anyway. And that's not many people. That's going to be like 3% of people that watch this want to do this. And 97% of the people that watch this that are fascinated with it should never do this because it's not for them. But the ones that are for them are attracted to it in some weird way, because they're like, I've had a concussion syndrome for years and I really want to open that up again. And they'd rather be uncomfortable or even have a nosebleed for 3 to 5 minutes with the hope that maybe they get relief.
Yeah, I was expecting it.
Were you feeling that too? Like you at least go, oh crap, let's just go for this.
Yeah, absolutely.
Yeah. So we'll see. We'll follow up and see how you're doing. I think we should do another video with your cat Venus, because Venus is very popular. Would you ever come back and let us do that?
Absolutely. I think she needs to be adjusted after traveling, for sure.
All right.
She just wants to see you.
All right. Thank you so much.
Whenever you're ready, I'll follow you.
There it goes.